Orthopedic conditions are diagnosed by first taking a proper history, taking a relevant history to see what the patient complains about, and then after that we do an examination of the patient to examine the patient to look at his condition, to examine the injured part or the part that is having symptoms, and then we order investigations like scans, like x-rays or MRIs or CT scans to image the affected part of the body. So in orthopedic conditions, it is very important to understand the patient's background, to understand the patient's occupation, the patient's hobbies, and the patient's level of activity. Because what we want to do when we treat orthopedic conditions is we want to return patients to their level of activity that they are accustomed to and they would like to get back to. So knowing the patient's background, the patient's other medical conditions, and the patient's expectation is very important, apart from just coming to a diagnosis of the patient's medical condition. Our bones and joints are important for mobility and for function, and injuries affecting the bones and joints restrict our ability to function, restrict our ability to be what we would like to be. In the last decade, due to advancements in technology, advancements in database collection, and advancement in biologics, we are now able to do surgeries much more effectively, much more safely, and with more accuracy and with less morbidity. For example, in the past we used to do a lot of surgeries open, meaning where you open a surgery and you do the operation. Now we do a lot of it through minimally invasive procedures, which is like keyhole techniques. Now with small incisions, we are able to do precise surgery. Now in the area of spine surgery, we not only have minimally invasive techniques, which means that we do the surgery with much less bleeding, with much less pain and suffering and much faster recovery. We also have intraoperative neuromonitoring. Now one of the biggest fears of spinal surgery is paralysis and danger and damage to the nerves. Now with intraoperative neuromonitoring, we are able to monitor the electrical impulses of the spinal cord and of the nerves in the operative field, and therefore we are able to prevent the catastrophe of major spinal injury, because once we have any surgery that goes near an important part, the alarms will go off during surgery. So this will give us a much more safer and much more successful outcome.